Hello, private duty nursing or PDN providers. This video has been tailored specifically for you. First things first, thank you. Texas Medicaid clients rely on PDN providers like you, and we're glad that you're here to help communities all over Texas. We would like to help you streamline your prior authorization requests, so we'll give you some tips and advice for submitting your requests and making sure they are processed quickly. Now let's get started. Before submitting your prior authorization request, the client must be 20 years or younger. Clients who are 17 years of age or younger must reside with an identified responsible adult. The PDN provider must have an RN perform a nursing assessment of the client within the client's home environment. This assessment must be performed before seeking prior authorization for PDN services, including recertification and revision requests. Assessing the client while the client is in the hospital cannot replace the RN nursing assessment of the client within the client's home. Dates of service requested prior to the RN nursing assessment within the client's home environment cannot be considered for prior authorization. The client must have a primary physician who signs the TMHP CCP prior authorization request form, plan of care, and Section 5 acknowledgement of the nursing addendum to plan of care for private duty nursing. This primary physician must provide continued medical care and supervision of the client. Initial requests for prior authorization require examination or treatment within 30 calendar days prior to the requested start date on the TMHP CCP prior authorization request form. Recertification requests require examination or treatment by the ordering or primary physician within the last 365 days prior to the requested start date on the TMHP CCP prior authorization request form. This requirement may be waived with the submission of a waiver letter. However, the client must be seen by the ordering physician within the 365 days prior to the requested start date on the TMHP CCP prior authorization request form for recertification and revision requests. The waiver letter must be signed and dated by the primary physician and address the following 4 criteria. Diagnosis has already been established with the primary physician. The client remains under the primary physician's continuing care, and the client remains under the supervision of the primary physician. Must be based on the primary physician's written statement that an additional evaluation visit is not medically necessary. When submitting your prior authorization requests, it's important to remember the prior authorization request needs to be complete. The key to a fast review and processing time for your prior authorization request is making sure all of the required prior authorization request forms are submitted and the right information is on these request forms the first time. So, what happens when you leave out information? Without all of the necessary prior authorization request forms submitted and containing all of the required information, the prior authorization department might have to send the request back for resubmission, deny your request, or pend your request for clarification. In some cases, the nurse will send it to a physician for a more thorough review. Any of these setbacks can cause a delay in the process. So what happens when I need to change or correct information on the prior authorization request forms? Any alterations or additions to the original prior authorization request form or forms must be initialed and dated by an authorized individual. These alterations or additions must be made by using a single-line strike-through, so the original content is still legible, and the author of the alteration must initial and date the revision. Any form submitted with whiteout will not be acceptable, even if the alteration process just described is followed. So, what happens if I want to redo the prior authorization request forms that do not require signatures and/or signature dates due to the changes or corrections needed? If redoing prior authorization request forms that do not require signature and signature dates, the prior authorization request forms must reflect a new date in the date field on each prior authorization request form to include the date the form or forms were redone. Now, we will take a look at each prior authorization request form and discuss some of the common mistakes PDN providers make when submitting them. Please note, all starred fields on the required prior authorization request forms are essential or critical fields on the Texas Medicaid Home Health Plan of Care, or POC. This means your request cannot be processed if any one of these fields is blank or incorrect. In addition to the essential or critical fields, most other fields on the form are required to be completed before prior authorization can be completed. A good rule of thumb: if in doubt, fill the field out. THSTEP CCP Prior Authorization Request Form. The correct type of request box must be marked. If the client is changing providers and there is no break in service, the request is a recertification, not an initial or new client, even though the client is new to the now requesting agency. Any break in service, even 1 day, results in the request being an initial request for services. Quantity must be requested with a single whole number. The words up to and decimal places may not be used. A frequency must also be requested. This form is to be signed and dated by the primary physician within 30 calendar days prior to the requested start date. Any form signed more than 30 days prior to the requested start date cannot be accepted. Dates of service requested prior to the physician's signature date cannot be considered for prior authorization. Plan of Care. PDN providers may submit the Texas Medicaid Home Health Plan of Care, or POC, or an agency-created plan of care, as long as it contains all the information in the Texas Medicaid Home Health Plan of Care. The POC must be signed and dated by the primary physician within 30 days prior to the requested start date on the THSTEP's CCP Prior Authorization Request Form, and include required information. The information received to be in the POC can be found in the Primary Physician Requirements section of the Texas Medicaid Provider Procedures Manual. The most common items missing from the plan of care include the physician license number and the date last seen by the primary physician. Dates of service requested on the THSTEP CCP Prior Authorization Request Form prior to the physician's signature date on the plan of care cannot be considered for prior authorization. If submitting the Texas Medicaid Home Health Plan of Care, or POC, the starred fields are essential or critical fields. This means your request cannot be processed if any one of these fields is blank or incorrect, with the exception of the SN and HHA quantity visits requested fields. These fields may be left blank as they are not applicable to private duty nursing. Only a valid HCPCS code is to be present in the HCPCS services requested field. A description of a HCPCS code cannot be accepted. Nursing Addendum to Plan of Care for Private Duty Nursing. Section 1. Nursing Care Plan Summary. Requested start date, requested end date, and number of PDN hours requested must match the dates of service and hours requested on the THSTEP's CCP Prior Authorization Request Form. If nursing orders are documented, they must match the plan of care. Nursing Addendum to Plan of Care for Private Duty Nursing. Section 2. Summary of Recent Health History. The nursing care summary is not merely a list of events or reiteration of the orders in the plan of care. The summary gives the PDN provider an opportunity to request the client's recent health problems and should create a complete picture of the client's condition, recent health problems, current health priorities, and nursing care needs. This section is the place to indicate the frequency of nursing interventions if they are different from the physician's order on the POC, such as clarification of PRN as needed interventions. For example, if the client is to receive nutrition orally prior to infusing via tube, the PDN provider should indicate how much of the ordered nutrition is given orally and how much is infusing via tube for each feeding or a number of tube feedings the client receives each day. If the client requires suctioning of a tracheostomy, the PDN provider should include the frequency of a tracheostomy suctioning with a numerical value. If nursing orders are documented, they must match the plan of care. Nursing Addendum to Plan of Care for Private Duty Nursing. Section 3. Rationale. If a number of PDN hours is documented, these hours must match all other prior authorization request forms, and if documented, must be the correct type of request, for example, initial, recertification, or revision. If nursing orders are documented, they must match the plan of care. Nursing Addendum to Plan of Care for Private Duty Nursing Section 4, Schedule of 24-Hour Daily Flow Sheet. Removing the days of the week from some of the pages cannot be accepted. The caregiver must be identified with identified caregiver codes for the entire 24-hour 7-day period. The identification of the PDN or N as the caregiver must match the hours requested on the other prior authorization request forms. The nursing care needs ordered by the physician must be reflected as ordered in the plan of care, regardless of whom performs the care. Some nursing care needs may take more than 15 minutes to accomplish. These activities must be completed accordingly on Section 4. Example, if the client is ordered tube feedings over 1 hour, 1-hour tube feedings must be reflected on Section 4. Flushing via tube are nursing care needs and must be reflected on Section 4 as ordered in the plan of care. Medications are nursing care needs and must be reflected on Section 4 as ordered in the plan of care. Nursing Addendum to Plan of Care for Private Duty Nursing Section 5. The client or responsible adult, PDN provider, and primary physician must sign, print their name, and date the same form in the required fields. Dates of service requested on the TMHP CCP Prior Authorization Request Form prior to the signature date of any party on Section 5 cannot be considered for prior authorization. CCP Prior Authorization Private Duty Nursing 6-month authorization. This form may be submitted with recertification requests and is only required to be submitted for recertifications when the dates of service requested on the TMHP CCP Prior Authorization Request Form are 180 days. What about sending additional documentation? Example, nursing notes. Sending excessive documents can create additional issues for timely processing. Additional documents are not required unless a pending letter is received asking for additional information. What documents do I need to send when a client transitions from an MCO to FFS? All requests to transfer the authorizations from the MCO to FFS must include a copy of the previously approved authorization letter from the client's MCO. TMHP will not pen a request asking for this authorization letter. It is the responsibility of the PDN provider to submit this authorization letter. All of the documentation that was sent in the original authorization request, including any physician orders that were used to determine the start of care. A completed TMHP CCP Prior Authorization Form. This form must include the dates of service and quantity being requested from TMHP. The requested start date is the date in which the client became FFS. The requested end date is the end date on the MCO authorization letter. The quantity requested must match the MCO authorization letter. Please note, it is not necessary to obtain signatures or dates on the forms listed above when submitted to TMHP for the purpose of transferring an authorization from an MCO to FFS Medicaid. A few more important things. If a previous submission was denied as incomplete, returned to you for missing or incorrect information, illegibility, incomplete alterations, outdated, incorrect or incorrectly recreated forms, when resubmitting, the entire complete request must be resubmitted. TMHP cannot utilize previously submitted documents for resubmissions. If your request is pended asking for additional information, submit only the requested additional information outlined in the pending letter. Additional documents not required, or resubmitting already received documents during the pending process can create additional issues for timely processing. Finally, you can find specific information about the policy, HCPCS codes, and other requirements in the Texas Medicaid Provider Procedures Manual, or TMPPM, which is available to the TMHP website at www.tmhp.com. You can also reach out to the TMHP Contact Center at 1-800-925-9126 for more information about the TMPPM.